Hi, my name is Stephanie. I'm a first year medical student at Des Moines University here in Des Moines, Iowa. And COVID has been a little bit crazy around here.
Hello, my name is Erin, and I currently live in Japan. I live in Niigata Prefecture. So, Josh asked me to do a little bit of a video to talk to you about sort of the situation of COVID 19 and what it's like here, and just to give you some perspective.
Hi, my name is Jessica Toole, and I am a phlebotomist working in Montgomery County, Maryland. I've been on the front lines of the COVID pandemic for, well, since pretty much the beginning.
My name is Jacob Erickson. I live in Las Vegas, New Mexico, and this is a response to the COVID 19.
Hi, I'm Deborah Erickson. I'm here at home. I am staying at home due to the COVID-19. I never once in my lifetime thought a situation like this would ever happen.
My name is Eric Erickson. I've been retired since 2003, so I'm used to staying at home, but this is an entirely different experience.
This recording is about the coronavirus. I just want to check in with everybody to let people know kind of what my opinion is and what I've heard so far about how things are going.
Hi. Well, I'm going to tell you what's going on in quarantine. Actually, quarantine isn't that different from the way that I normally live.
Hi, my name is Danielle. I'm 29 years old and I live here in Columbus, Ohio. I've been asked to basically talk about COVID 19 and how it's affected lifestyle, job, and also my thoughts on it.
It's something that I'm sure everybody's having a little hard time with it.
When I first realized this was happening over in Wuhan, China, it was concerning, but never did I ever think it would spread as rapidly as it has over the last 2 months.
I never thought in my lifetime I would ever see a virus shutting down everything economically, and also with everybody else, quarantining people who are not only high risk, who are super healthy as well.
This pandemic has really turned my life upside down. I'm sure I'm not the only one, but I can just speak from personal experience that the stress has just been crazy.
This virus is a deadly virus, and they're saying that you shouldn't be afraid of it, so that's good. That's really good. Because, it kills only vulnerable people, but it also kills people that aren't vulnerable, so you gotta be really careful. It just kind of kills everybody.
I don't work in hospitals, but I do work in an outpatient setting, and I have had a couple of exposures. I had one confirmed exposure that resulted in me being quarantined for a week and a half while I waited to see if I developed symptoms or not. And just today I found out that I've had two more exposures, yesterday and Monday of this week. And now we're just trying to figure out what happens next.
The biggest thing is we don't know what the future is. How long this is going to last, I think it's going to last longer than some people are predicting, and I think there's a great possibility of this having a second wave that could be even more devastating than the first wave. And if that should happen, I have no idea where we'll go from there.
It's very concerning. I've got nieces and nephews and a daughter who work as healthcare professionals. I am concerned for their safety every minute of the day.
It's scary. I mean, it's going from every day of, is this the day that I'm going to get it? Have I already gotten it? And do I just not know it yet? It's difficult, but we have to be there for the patients. It's not going away anytime soon, and we just got to keep working until we can get rid of it and stay put when we're not at work.
I was sick for a while. I had a fever and my lungs felt like crap. I do have asthma and I had to use my inhalers a lot more, but being in the medical world, it didn't really freak me out that much. We just kind of learned to roll with the punches. Previously, I worked as an EMT, and you just have to roll with it. What happens, happens, and that's the way it goes. We take it as it comes. So if it turned out that I got super sick, then I would deal with it at that point. But until then, you just kind of keep on going.
It's been an interesting experience. I myself have been going through some health issues since February and was tested for COVID-19 back in February, and it was negative. I was retested, also negative. But it was pretty intense, and going to the doctor and sort of being in the middle of like the hot zone of activity with that has been unnerving, to say the least.
So once you do get sick, they're saying not to go to the doctor's offices because we shouldn't be spreading this disease around, and everybody should stay on lockdown, which is very important. We must stay on lockdown until this is all over. But again, it's not going to be all over until we all build up our antibodies and we affect each other and everybody has the antibody in their system, which means that really this isn't going to be all over even when we come out of lockdown. So who knows what's really going to happen?
I think that staying home is very good for the country because I think that people have not been very diligent to their time with their families and children and developing hobbies.
So the other question was, what have I been doing then in this sort of quarantine, social distancing life? I have really sort of been revisiting some of my former passions. I have been studying Japanese because I live in Japan, so still really relevant for me to learn the language, so I've been working harder on that. I've been working on a TESOL certification relevant to my job. I have been playing video games and going for lots of walks and hikes and things, and really just trying to be, active in ways that don't involve other people.
Yeah, I really am excited about having a chance to be at home. I am in a wonderful position where I have enough vacation leave saved up, and I had so many projects built up that this has been a real relief for me.
I've been getting better at drawing. Here's my sketchbook. I've been working on that. Also, it's like really relaxing. Start drawing. Before I started this, I could just draw stick things. That's it. And I never could draw anything, and I flunked out, I got a D in art in university because I had like no perspective. When you start drawing, sketching, you just get better and better and better because you start drawing what you're seeing instead of what you think you should be drawing. I've gotten a lot better.
I've been playing keyboard and singing a lot and trying to create and connecting with people and really reaching out to family and friends. And it's one thing I will say about having the time is that like the time difference is normally very tricky to navigate, and having this sort of time to be able to reconnect with family and friends and at various times in the day have been really, really nice because I don't always get that opportunity given the time difference.
We are essential workers. We both work in law enforcement related jobs, so that's been keeping us busy. I work for a local hospital here in Columbus, actually a couple of them, and we have actually been pretty slow, shockingly. Obviously, there was no spike that they were like talking about, thank God.
Big thanks to everyone who's out there working hard, and especially in the hospitals, working with the patients in the ICU. I have a friend who works as an emergency room technician and has been dealing with quite a few COVID patients and is almost at the point where she's going to be camping out in her garage to avoid potentially infecting her wife. And it's rough, but it's what we got to do to get through. And it's the sacrifices that we make for taking care of our patients.
So we've really actually been slow. I know the ICUs have been kind of busy. I have a lot of nursing friends that say that they've been actually pretty busy. It's been a little hectic. Other than that, my job has been slow. As for my husband, he is actually out on the street. And as you can imagine, it has actually been pretty crazy. A lot of drunk calls, domestics, a lot of mental people who are also quarantined, kind of going crazy. So he's having to respond to all of that. So it's been pretty interesting for him hearing all the stories and how people are really coping with this whole quarantine and also not being able to do a whole lot of anything.
I do massage therapy, and I haven't been able to work for 5 weeks. It looks like it's probably going to be at least a couple of months before I can go back, and I have no idea what the landscape is going to look like when I do go back. And I just can't wait till it's over.
I'm currently working from home. I am very, 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 very blessed in having the ability to do that. I fall into a weird category of employment here, so my job isn't necessarily considered essential, but I was going to work for quite a while up until a couple of weeks ago.
I'm still working full time, and I probably shouldn't be. Shouldn't leave my house, but I do. I feel that everything I do is through video chat, so I feel like I'm being safe out there.
This hasn't impacted me a whole lot just because I'm still studying 15 hours a day. I'm still putting in the time. I don't have time to socialize and go out anyway, so it hasn't impacted me a whole lot there. What it has done is limited my time with my classmates. Normally studying, I study in a group. There's a whole bunch of us that get together and we go over the material. Something that I would miss, someone else would pick up, and we rely on each other like that. And through all of this distance learning, it has been really difficult to do that. So I've had to rely on myself a lot more, which has been difficult but manageable. I would say overall, not a whole lot has changed.
I miss my work, I miss my peeps, and I try to stay in touch on text and things, but it's not the same. I had to either choose to go all the way and stay at work and basically isolate myself from my home, or come home and be here. My mother-in-law is 85. I am asthmatic and have high blood pressure, and if I had stayed at work, I would have been at very good risk, and if I had stayed coming home every day, I would have been putting my mother-in-law at risk. Not only that, but I feel like my work had been curtailed to the point where I wasn't really being very effective at work anyway. So better to come home and do some things that really need to be done. And I'm just really grateful that I had the resources to be able to come home and do that.
My husband's been home for a month because we kind of got scared around the New Mexico surge time, and because he had a lot of hours built up and could come home. There's a PEX, it's a mana block. So while my husband's been home, he replumbed our whole house. We've been working on our garden. He's hooked up my washer and dryer. Oh my goodness, we've just been doing a lot of things.
And so deciding to stay home has been wonderful. I've redone our plumbing. I've taken care of projects that need to be done for years. And this has been a real opportunity for me. It also helps me to kind of readjust my sleep cycle and my daily existence to where I'm feeling like I'm more human. So that's pretty nice too.
I take care of my 84-year-old mom here. We live in the mountains. I mean, I don't go to town as often. That's about the difference of it. The truth is, we're kind of isolated up here, and I don't get together like up close to people and talk to them, but otherwise than that, it's not that different for me. And I'm lucky. I haven't lost a job, and I haven't lost my home. My heart goes out to all those people who are having real bad struggles at this time.
So I'm from the United States. I'm watching things unfold there and been, in close contact with my friends and family there. And I'm, of course, watching it unfold throughout the world. Japan has been a little bit different. We've been a little bit slower on the uptake as far as our action here hasn't been as severe. And there's lots of reasons for this, primarily political, because, Japan doesn't have the same decision-making capabilities that other countries do in terms of being able to enforce hard lockdowns. So people aren't as worried about it. Like, I think there's been a lot of mixed messages as far as like how people have been sort of thinking about the situation. I think there's this sort of attitude of like, it doesn't affect me, so it's not real. And because there haven't been hard lockdowns, because there hasn't been the follow through from the government, people aren't taking it as seriously, which is kind of unfortunate. But I will say, in other ways, there have been some things that are helpful, like the mask wearing culture, is a thing here anyway. So that was very natural for a lot of people. We did have a toilet paper shortage back in February, so that happened ages ago. And things have been sort of ramping up as the number of cases have risen. So to have the rules of engagement and going out, so people are finally social distancing. I've been social distancing since about February, and it's been interesting.
You know, Las Vegas itself has been under quarantine since March 23rd. So tomorrow will be our first month in lockdown, or at least stay-at-home orders. I myself have left a couple of times for groceries, but a lot of the times that I haven't been at home has mainly been just to go out for a drive up the mountain. I do most of my thinking there. I've thought a lot about this COVID-19. I've thought a lot about my job. I've thought a lot about life.
I live close to downtown. There's been lots of cases. I think currently we have just under 2,000 cases here in Des Moines. And my medical school has taken to online courses ever since spring break, which was about a month ago now. So things have gotten a little crazy with campus. Our campus is still open because our governor here in Iowa hasn't set a stay-at-home order. So the campus itself is open, but it is now badge access only. All of our lectures have been switched to online formats, and we are highly encouraged to stay home. So yeah, COVID has been interesting, but it's still another day, another lecture, and that's just how we have to deal with it.
I mean, to me, this has been a win-win, even though I realize it's a severe situation nationally and could be serious locally, although we haven't seen the kind of impact locally that many places have. Really enjoying kind of re-gearing here. It's been good.
It's been really frustrating having so many different conflicting inputs of information about what to do, what not to do, where to go, where not to go. I know that it's all confusing and it's not new. This is maybe part of the frustration, but it's certainly the first time I've ever had to deal with this.
So I hope that, going forward, you all are out there staying safe and practicing social distancing. I think there's a lot of information going around saying, well, but if you're isolating, then you're creating more of a problem, et cetera, et cetera. And it's like, well, I understand the logic behind that. I do, but I also think the distancing is important for flattening the curve, because the reality is that all of our medical systems are overtaxed, and you're seeing it in the United States, you're seeing it here in Japan. It's getting worse and worse. And so I definitely recommend, just being sort of aware of that. And so please stay on top of it. Be diligent as best you can, because I think that's the best thing that we can all do. We're in this together. So let's do our best. Ganbarimasu. Ganbarimashou. Matane.
So I think that social distancing, while inconvenient for those who get out, which I don't, is good for stopping the virus or putting it in check. Being at home is good. What can I say?
My main takeaway from this COVID-19 is, well, number one, I'm 29 years old and I haven't really experienced anything this hugely societal affecting other than the 2008 recession. I thankfully have a job and a roof over my head and food in my belly, so, I'm not particularly up in arms over much. I'm more or less still living the life I've led prior to quarantine. I'm usually mostly home all day and at the school, so, my life really hasn't changed all that much. But I do want to say that I am proud of our local leadership. I wish I could be proud of our federal leadership, but I can't. I didn't mean to make this political, but I guess I did. I think Dr. Fauci is doing a good job with explaining things, but I think the main people in charge, aka our president and his administration, at least bits and pieces of it, I don't think are doing a good job. Ultimately, I just want to say that for the last couple of years now, we've been talking about needing a new plague or having an asteroid come and wipe us out, and we're getting that. Still, vote asteroid 2020.
Fortunately, our family has not had any deaths in the immediate family or friends. But I've got a nephew who lives over in the southwest part of the state who's on the Indian reservation, and he and his wife and little girl are currently in lockdown. and I'm concerned about them. They can't get out, they can't see anyone. It's very difficult on everyone, but some people a lot harder than others. And I'm thankful to our governor, Michelle Lujan Grisham. I think she's doing an outstanding job in keeping our state as safe as can be and not opening up the state as soon as others are. I think she's staying on top of everything, and it's being responsible, and kudos to her.
As you can see, I'm filming this from outside my apartment because I ain't going nowhere else besides work.
Of course, eventually they will come up with a vaccine and a treatment, and I'm sure this will be taken care of eventually, but there's so many questions about the future and how the country will recover. And I think the majority of the governors in this country has done a so much better job than our outstanding leader that we have. I don't think anyone really knows what the future is.